Cruciferous vegetables play a special role in cancer prevention medicine as they contain indole-3-carbinol and folate, which aids in the detoxification of excess estrogens, which are linked to many types of hormonal cancers. Our professional guests are here with me again to share more on cancer wellness. First, we have Linda Eagen, President and CEO of the Ottawa Regional Cancer Foundation, who has developed a variety of revenue-generating programs that have raised over $100 million in support of health, education, arts, culture, community, and social welfare organizations. To add to her numerous awards, recently in 2011, Linda was awarded the prestigious Trudeau Medal from the Telfer School of Management. We are also joined by an integrative oncology specialist and naturopathic doctor who is the founder and executive director of the Ottawa Integrative Cancer Centre here in Ottawa. The OICC is the first integrative cancer centre here in Eastern Canada. Dr. Dugald is well respected for his groundbreaking pioneer work focused on a modern-day cancer treatment model based on scientifically grounded, evidence-informed complementary medicine. Welcome.
Thank you.
I feel like both of you, have so much to just help people understand that you do for the community. Going back to the center, Linda, we left off at the 4 pillars of what the Cancer Center is about. We want to clarify the coaching process. Help us understand the coaching process.
What we do at Maplesoft Center is offer survivorship care. Survivorship care is personalized care, it's non-prescriptive, non-judgmental, it goes where you want to go. We do that through an amazing team. We've got cancer coaches. There's a group of 6 right now that are healthcare practitioners, they're professionals, they have a depth of expertise in oncology. They can answer questions and they can coach you through any need that you may have, whether it's emotional, how do I tell my children about cancer, how do I go back to work, I don't know how to talk to my doctor, what does this mean, what should I eat? The coaches, cancer coaches, have that level of expertise. Then we have an amazing community, which includes you guys, that are community coaches that come in with the expertise that you have and organize different workshops, spend time with people, helping them understand everything that you do in terms of nutrition is so vital, and complementary care. There are so many people that self-medicate through cancer.
Yes.
And we don't tell other people about it because we're afraid.
Yes.
Well, because we're working together, we're going to change that, right? People are going to be comfortable in talking to their oncologist and their naturopath. They're not enemies.
And I think that's an important point, because we talked about what it's like from a patient's eyes to straddle the system.
Right.
And what we mean by that is we mean complementary care and our traditional model. Because sometimes your physicians are going to be very favorable and sometimes there may be some resistance.
Sure.
What can you share for somebody who might be in that situation?
Well, I think communication is the key. I mean, and the patient really is going to be the arbiter of their own care. They're the ones that the therapies are being done to, and they're the ones who are coping with the disease. So they need to be able to navigate through the system to make the choices that they want and they need to make. So communication, patients want communication to be effective between all the different healthcare practitioners that they are seeing. Obviously, the oncologist is a central figure in that, but there is a lot of other practitioners that people are using, including naturopathic medicine, that is an important component of care. So if we can try to augment the communication and build a network of collaboration, if you will, then that's moving towards a more integrative approach, and ultimately will put the patient in a better place as far as their health and as far as reducing risks as well.
Exactly, because people are doing it anyway. They're going to the health food store and they're picking up this and this
Absolutely.
because they've heard something about it.
That's
so
right.
we just want to make sure that they're getting guidance.
Getting guidance, and there's a lot of things that are very beneficial that can be added if they're done in a safe way. And then there's a lot of things that maybe shouldn't be done. So it's really having the education, the communication about that is so key.
It is key.
I walked into the Maplesoft Center and we were doing sort of an education,
Right.
and there was laughter therapy going on. Tell us about that.
Laughter therapy is one of the things that we offer at Maplesoft Centre to help people through their journey. Everybody, I mentioned in the earlier segment, we recognize that everybody has very special needs and they're very personal. So laughter therapy, visualization, yoga, fitness, nutrition. We have music therapy. We have a program that just kicked off recently where you can write your own song, and how the people that are participating in that, you know, if that's the outlet for you, are saying how wonderful it makes them feel. There's, Tamara mentioned a lot of feelings that you go through, and it's nice to have an outlet.
And I think the previous model used to concentrate a lot on the physicality of things.
Yes.
And now we're bringing the emotional component into it. How important is that, Dr. Seeley?
Well, I mean, there's obviously the pathology of the disease, and what is happening physically is critically important and needs to be dealt with very well. But the whole emotional side, the spiritual side for some people are equally important for them. And it's we were talking about this before, the perception of the disease and the perception of how one is going through that is such a core part of how one copes with the disease. And so looking at that and some of the programming that the Ottawa Regional Cancer Foundation is providing, and some of the therapies that we provide at the Ottawa Integrative Cancer Centre, try to touch on those emotional aspects of health that are so important, as well as the physical, for sure.
And in the next 5 years, what would you like to see happen with the centre?
I'd like to see another centre,
Yes.
because we opened the doors November 2nd, and we're over 800 members right now.
Wow.
And clearly that speaks to the need in our community. We'd like to, you know, collaborate more with groups like Dugald's group to offer care close to home, and to really melt down those barriers, those boundaries that we've created in the healthcare system.
Exactly.
Yeah.
Now, one of the barriers can sometimes be cost. So can we touch base on that from your perspective, and then of course Dr. Seeley?
Maplesoft is a hub intended to help people navigate and to regain some type of control. We offer those services for free, and they don't require referral. Now, the community is what makes this possible, because all of the fundraising events that we organize at the Cancer Foundation, the Run for Dad, and all these other things throughout the year is what funds the programs. It's by the community for the community, which in and of itself is empowering, I think. Yeah.
So it's very important that people learn about the events. You've just recently had the Bus to Move with Richard Simmons.
that was incredible. Yeah.
Did you wear shorts standing beside him?
No, I didn't actually. I didn't. No.
And what are your events that are up and coming?
Well, we have an annual tradition on Father's Day, which is the ultimate run for men's cancers, Ultimate Run, and we have a number of golf tournaments and different activities throughout the year. It's best way to find out is to go to our website, which is www.ottawacancer.ca.
And I think it's important that people understand you don't need to be a marathoner, you don't need to be somebody who runs a lot.
No.
These are family-friendly events. Our family typically does the Alterna run, and it's just, we're just doing it as a family.
That event is such an amazing, it's a feel-good event. It's the morning of Father's Day. People come as families. We have pancakes, we have fun, and and then you go eat some more of a brunch with the rest of your family.
Exactly.
Why are pancakes always associated with father?
I don't know. What did you have this morning for breakfast?
It wasn't pancakes.
It was close.
I like cooking
It was
pancakes,
close.
so it's true. It's good.
Yeah, I think there's something about pancakes and dads and home and
Yeah.
Sunday,
Yeah.
something about that.
It's tradition.
So Dr. Seeley, in terms of the expense for patients, can you help people navigate that concept?
Yeah, it's a really important concept for sure in terms of complementary medicine, because it is often fee for service. It's not covered by OHIP. We at the Ottawa Integrative Cancer Centre, we are not for profit. We're associated actually with the Canadian College of Naturopathic Medicine. They provide the governance for us, and so we are aiming to provide a certain level of subsidized care, and it's something that we're fundraising for as well. But we're, rather than profits being driven into some private corporation or members, we're driving back any sort of surplus, if you will, into providing more subsidized care and also into research. So it's a nice to have that model and the support from the college in Toronto, and it's something that we're I think we do exist to some degree in a two-tiered system in Canada, although government-funded care is a core principle for Canadian healthcare, which is fantastic. Obviously dollars can only go so far, so difficult to get onto that funding. I think that what we provide is actually a more proactive preventative care, and there would be cost effectiveness and cost savings that could be achieved. But we're a ways away from that. But subsidized care is
and that's what research shows, is that if we work preventatively, of course, we have to spend less, and many people may have third-party insurance coverage as well.
Absolutely, there is that, and Ottawa is a good place for that, for sure.
Exactly.
Yeah.
What are the 5-year goals of the OICC?
Good question. We're very much in our early days right now, and we're just opened in November 2011, and we're expanding as of this summer. And so right now we're in a place in Hintonburg, but we're looking to expand into a purpose-built center down the road. So we're looking to do a large fundraising campaign over the next few years for that.
Excellent. So again, if you hear OICC and fundraising, make sure you join in, or Maplesoft Center. We have a couple of email questions. So this one's for you, Linda. Sure. Julie asks, I don't live in the Ottawa region. She lives in Manitoba, but would like to get support through my cancer therapy. Where is the first place I should look for integrative approaches?
In Manitoba?
Yeah, so throughout Canada, where else can people look?
We're a bit of a unique organization in Ottawa. You can call your cancer center. I would suggest that that's probably the number one, the first place to start.
Excellent.
In other parts of the country, there's integrative health in BC is Inspire Health, and we have Wellspring and Gilda's houses. But your cancer center should be able to direct you.
Yes.
Yeah.
And thank you. And another question, Gary asks, I noticed you talked about how people speak to their children about the whole process. So Gary asks, how can I teach my kids about cancer without scaring them?
Yeah, that's a tough question. I think it's really depends on the child himself, obviously, and the age of the child. There are certainly resources, and there are books that are available to help guide children through from their own perspective, so they can see it, not from the overwhelming perspective of maybe the delivery that an adult might give, but there's ways of couching it for kids, and I think looking for resources for that.
So lastly, our quiz. This will just be easy.
It's a quiz.
A quiz.
Are you ready for that?
Number 1,
No.
is
That's a trick.
inflammation related to the development of cancer? These are easy.
Sorry, I missed the
Inflammation.
Oh, yes.
Yes. Number 2, do mushrooms have the ability to boost immunity?
Yes.
Yes. And number 3, do certain foods have the ability to halt cancer cells? Yes, in test tube models. Yes.
I was going to
Dugald
let
is a
the doctor
researcher,
report.
so I know. Thank you very much, both of you, for all of your wonderful information, and you're very inspiring in the work that you do. So we wish you very well, and I'm sure we'll be seeing you again.
Thank you very much.
So